First, I'm going to ask you permission. Are you okay if I share this with other patients?
Yes, I am.
Other patients? I will
Yes.
put it on my website or maybe on YouTube just to share with other patients. They can
Yes.
link with it. Okay.
Okay.
And
Okay.
just share with the patient what was your experience when you came with surgery? Why did you have the surgery? And just tell me what you just told me.
Well, about a year ago, I had the surgery on both sides of my mouth of going into the gum and hopefully decreasing the pockets. Over the years, I've had a history of big problems, despite I was trying to take care of my teeth, but nevertheless, the pockets were getting worse and worse. And finally, it was recommended highly that I really needed that surgery to save my teeth. So, who looks forward to that? We all hear a lot of stories about gum surgery and like anyone, I was trying to ward that off as long as possible, but it became inevitable when my numbers were 7s, 8s, 9s. So I made an appointment with Dr. Penhaskashi, and who actually I had heard very good things about. That is why I came to him, and felt like I was really, it was inevitable, and I knew it wasn't going to be a picnic, but did it as a present to myself. I'm in my 60s now, 64 years old, so it was last year that I came, and I want my teeth as long as I can. That was my goal in giving myself this present. Financially, it was, you can always think of other things you'd certainly rather do with a quantity of money than, but I nevertheless did this as a present to myself. So I went through this experience with Dr. Penhaskashi and had great results. My numbers are now not down 1 or 2 notches, so to speak, but 3s, 4s. I have one area that I got to work on a little. It's a year later now, but it's a 5. But dramatic results. So about 6 weeks after the first surgery, it was time to do the other side. And I actually heard from some friends that their experience was with another doctor. I definitely was with another doctor because the person doesn't live anywhere around here. But they said, how could you go back a second time? The first one was so awful to have. And I didn't feel that way at all. I wanted the other side to match what I'd just done on the first surgery. So indeed I did go back, and in fact the second time I kind of knew what I was getting into. And the recovery was not that bad. Took a few of these Tylenol 800s and watched what I ate. Certainly didn't chew hard things, and the one side I would use more. Obviously, I used the one side that had recovered, while the other side was healing, and then vice versa when I had the surgery on the second time. So it all works out, and here I am a year later to say my numbers are. I have a different mouth. I'm not sure how long these teeth would have been in their sockets had I not had this surgery last year. Could be another couple years with luck, but now I hope I live a long 20 years or more with these normal pockets now. Can keep my teeth as long as I can.